According to a vital signs report from the Centers for Disease Control and Prevention, about 1 in 3 adults aged 50 to 75 years have not been tested for colorectal cancer as recommended by the United States Preventive Services Task Force. As the infographic explains, if you are over the age of 50 or you have a family history of colorectal cancer or polyps, you should schedule a colonoscopy. The specialist at Advanced Gastroenterology and Surgery Associates explained that the prep for the test is not as bad as it once was. So scratch that off your list of excuses for putting off a colonoscopy.
Most patients after the procedure, after having had a colonoscopy, would say it wasn't as bad as I thought. The bad part is the preparation, the day before. We have to cleanse the colon. The colon has to be clean. The cleaner the colon, the better we see. Because, we're humans, we can miss things. The colon has a lot of folds, and there's a lot of spasm, so you can actually miss small polyps. So there's always a potential miss rate for colon screening. So the preparation is very important. Unfortunately, the prep is not tasty, and there's a reason for that. When we cleanse the colon, you lose a lot of electrolytes. So the bad taste in the preparation is really from the electrolyte replacement in the solution. And anyone who's ever taken potassium or sodium pills in the past would tell you that they taste horrible. There's a reason why the prep tastes bad, unfortunately. And until we can get electrolytes that taste well, then unfortunately the prep would be the worst part.
If you go back and you listen to folks who have gone through the prep on the day of the procedure, and I always talk to patients, well, how was your bowel prep, and do you have nausea? Oh, it wasn't so bad. The myth stemmed from back then, many years ago. Of course, advances are always being made. So go back years ago, the drink, it just because of the taste. That's number one, is quite salty. And then the volume is because it will distend the stomach and may cause nausea and vomiting and whatnot. But it has come a long way. The
actual procedure itself is relatively benign. Patients are sedated, either with moderate sedation or some even with general anesthesia. So the vast majority of patients don't recall the procedure or have any problems with it. Of course, there are always complications with every procedure that we do, which are small, but there's risk of bleeding if you remove polyps. There's also a very small risk of perforation of the colon where the patient may have to have surgery, but those risks are small and far between.
AGSA offers diagnosis and treatment for numerous gastroenterological conditions. For more information about their services and Lake County office locations, click the colon screening StoryLink icon at yourhometownhealth.com.